You are the nurse taking care of a 21-year-old female who complains of 2 days dysuria, that over the last 24 hours has been accompanied by fever, chills, and lower back pain. Her physical exam is remarkable for right-sided costovertebral angle tenderness. Which of the following is the most likely diagnosis? A. Genital herpes. B. Primary syphilis. C. Pyelonephritis. D. Pneumothorax. E. Spinal stenosis. The answer is C. Pyelonephritis. The patient's presentation with dysuria that progresses to include fever, chills, and lower back pain, is a very classic presentation of pyelonephritis. Pyelonephritis is an infection of the renal parenchyma, most commonly due to an ascending urinary tract infection. In this patient, who is a female, which places her at a greater risk for UTIs as compared to males due to females having shorter urethras than males, who initially has dysuria, this is a convincing story for a UTI. Further, the fact that the symptoms of fever, chills, and lower back pain are not present initially with the dysuria, but develop over the next day, is further evidence that pyelonephritis is the likely diagnosis. The physical exam finding of unilateral costovertebral angle tenderness also is highly suggestive of pyelonephritis. The other choices are incorrect. Spinal stenosis is not a common diagnosis in young, otherwise healthy patients, and would not account for dysuria and unilateral costovertebral angle tenderness. A pneumothorax would not cause dysuria and would likely present with shortness of breath. Primary syphilis and genital herpes would not account for dysuria, lower back pain, or costovertebral angle tenderness. You are the nurse taking care of a 21-year-old female who complains of 2 days dysuria, that over the last 24 hours has been accompanied by fever, chills, and lower back pain. Her physical exam is remarkable for right-sided costovertebral angle tenderness. Which of the following is the most likely diagnosis? A. Genital herpes. B. Primary syphilis. C. Pyelonephritis. D. Pneumothorax. E. Spinal stenosis. The answer is C. Pyelonephritis. The patient's presentation with dysuria that progresses to include fever, chills, and lower back pain, is a very classic presentation of pyelonephritis. Pyelonephritis is an infection of the renal parenchyma, most commonly due to an ascending urinary tract infection. In this patient, who is a female, which places her at a greater risk for UTIs as compared to males due to females having shorter urethras than males, who initially has dysuria, this is a convincing story for a UTI. Further, the fact that the symptoms of fever, chills, and lower back pain are not present initially with the dysuria, but develop over the next day, is further evidence that pyelonephritis is the likely diagnosis. The physical exam finding of unilateral costovertebral angle tenderness also is highly suggestive of pyelonephritis. The other choices are incorrect. Spinal stenosis is not a common diagnosis in young, otherwise healthy patients, and would not account for dysuria and unilateral costovertebral angle tenderness. A pneumothorax would not cause dysuria and would likely present with shortness of breath. Primary syphilis and genital herpes would not account for dysuria, lower back pain, or costovertebral angle tenderness. Eye lubricants are used for all but the following: A. To replace tears or add moisture to eyes. B. To moisten contact lenses or artificial eyes. C. To achieve meiosis during eye surgery. D. To protect the eyes during surgery or diagnostic procedures. The answer is C. To achieve meiosis during eye surgery. Eye lubricants are not used to achieve meiosis during eye surgery. Eye lubricants are frequently used to treat dry eyes in cases where tears need to be replaced, to moisten contact lenses, or to protect eyes during surgery. Which of the following is part of a standard treatment plan for a diagnosis of stage I Lyme disease? A. Administration of intravenous antibiotics. B. No treatment unless the disease progresses to stage 2 or stage 3. C. Administration of oral antibiotics. D. A topical antihistamine to reduce symptoms. The answer is D. A topical antihistamine to reduce symptoms. Stage 1 is called early localized Lyme disease. The infection is not yet widespread throughout the body. This is treated with a topical antihistamine to reduce symptoms. Which of the following is considered to be a normal age-related ocular degeneration? A. Glaucoma. B. Blepharitis. C. Presbyopia. D. Cataracts. The answer is C. Presbyopia. Presbyopia, or farsightedness, is caused by a loss of elasticity in the lens of the eye, and is considered a normal change with aging. Glaucoma, blepharitis, and cataracts all carry increased risk with advanced age, but are considered to be abnormal and/or pathological changes. Which of the following is not a risk factor for infertility in men? A. Moderate cigarette smoking. B. Frequent spy use. C. Untreated chlamydia. D. Major hernia surgery. E. Mild sun exposure. The answer is E. Mild sun exposure. Cigarette smoking and other poor lifestyle choices have been shown to cause decreased fertility in men. Surgeries such as hernia repair could also have a negative effect on male fertility. Sexually transmitted infection can cause fertility problems, especially if left untreated, in males and females. Frequent hot tub or spa use has also not recommended. Mild levels of sun exposure are the least likely of the above to cause infertility in men. The nurse is educating a 19-year-old female on contraceptive methods. The nurse describes which of these as the most effective? A. The male condom. B. Fertility awareness. C. Withdrawal before ejaculation. D. The female condom. E. A diaphragm and spermicide. The answer is A. The male condom. The male condom is the most effective when used correctly. However, if used incorrectly, carries a much higher risk of failure. The male condom is also the only method of the answer choices that also carries protection against sexually transmitted diseases. The nurse is educating a 23-year-old woman on contraceptive options. She describes which of these as the most effective? A. Medroxyprogesterone acetate injection. B. The cervical cap with spermicide. C. Oral contraceptives. D. Etonogestrel/ethinylestradiol ring. E. Contraceptive patches. The answer is A. Medroxyprogesterone acetate injection. Medroxyprogesterone acetate injection is the most effective of the listed methods. Other methods of the above carry the risk for displacement or incorrect use. The nurse should inform the client that the medroxyprogesterone acetate injection is not effective against sexually transmitted diseases. The nurse is educating families in northern Wisconsin on the subject of tick removal. The nurse knows that teaching has been effective when they state all but which of the following? A. Grab the tick as close to the skin as possible. B. A fine-ended tweezer works best. C. After grasping the tick with the tweezers, twist until removed. D. Use gloves to protect fingers when removing ticks. E. Save the tick in your freezer. The answer is C. After grasping the tick with the tweezers, twist until removed. Never twist, jerk, or rip the tick when attempting to remove them from the skin. Wear gloves or use a paper towel if they are not available. Seal the tick within a plastic bag and keep it in the freezer. If illness occurs, the tick may be useful for further testing. Which of the following is a bacterium frequently responsible for causing urinary tract infections? A. Clostridium botulinum. B. Escherichia coli. C. Candida albicans. D. Mycobacterium leprae. E. Treponema pallidum. The answer is B. Escherichia coli. Escherichia coli is a bacteria that lives in the normal flora of the intestines. However, it is also a frequent cause of urinary tract infections. Candida albicans is a fungus that frequently causes thrush and vaginitis. Mycobacterium leprae is responsible for leprosy or Hansen's disease. Treponema pallidum is a spirochete responsible for syphilis. Lastly, Clostridium botulinum is responsible for botulism as a result of its secretion of a neurotoxin. Which of the following bodily fluids does not transmit human immunodeficiency virus, HIV? A. Breast milk. B. Blood. C. Vaginal secretions. D. Semen. E. Saliva. The answer is E. Saliva. HIV is easily spread through all of the listed body fluids with the exception of saliva. A person may not contract HIV through exchange of saliva during activities such as kissing or sharing eating utensils. Which of the following regarding human immunodeficiency virus, HIV, is false? A. The risk of transmission increases in individuals who have another sexually transmitted infection such as genital herpes. B. In heterosexual encounters, it may be easier for a woman to contract HIV. C. The number of disease particles in a fluid is called the viral load. D. HIV can spread to other individuals starting 2 weeks after the host is infected. E. Healthcare workers have a relatively low risk of contracting HIV when using standard precautions. The answer is D. HIV can spread to other individuals starting 2 weeks after the host is infected. HIV may be contagious just days after the host is infected. Women in heterosexual relationships may become infected more easily than men due to prolonged exposure to bodily fluids. It is, however, possible for men to contract HIV from an infected woman. HIV is not frequently transmitted to healthcare professionals. Even for those who suffer from needle stick injuries, transmission is unlikely. Symptoms of acute human immunodeficiency virus, HIV, typically occur within how long after infection? A. 8 to 12 weeks. B. 1 to 2 weeks. C. 4 to 8 weeks. D. Greater than 1 year. E. 2 to 4 weeks. The answer is E. 2 to 4 weeks. Symptoms of acute HIV generally occur 2 to 4 weeks after infection. A vast array of symptoms may be present, such as fever, rash, generalized fatigue, nausea, vomiting, diarrhea, and a sore throat. The nurse prepares to insert a peripheral venous catheter, PVC. Which of the following is an incorrect step in this process? A. Secure catheter with tape. B. Assess for infiltration or hematoma. C. Hold skin taut to stabilize vein. D. Explain procedure to patient and confirm identity. E. Insert catheter bevel down at a 15-degree angle. The answer is E. Insert catheter bevel down at a 15-degree angle. The catheter needle must be inserted bevel up at an angle between 10 to 30 degrees. The correct steps for inserting a peripheral venous catheter, PVC, are: 1. Explain procedure and check identity. 2. Prepare equipment at the bedside on clean surface. 3. Apply appropriate personal protective equipment as needed. 4. Distend veins by applying tourniquet 4 to 6 inches above site. 5. Clean site with facility-approved cleaning solution. 6. Hold skin taut to stabilize vein. 7. Insert catheter bevel up at an angle between 10 and 30 degrees. 8. Pierce skin and vessel to enter vein. 9. Advance catheter until blood return observed, then remove tourniquet. 10. Withdraw needle from catheter and advance catheter to hub. 11. Secure catheter with tape or facility-approved dressing. 12. Attach forward tubing and begin infusion. 13. Assess for complications including infiltration or hematoma. The surgical nurse cares for a patient status post-umbilical herniorrhaphy. Which of the following nursing interventions is a priority for the nurse? A. Avoid coughing. B. Preventing overexertion. C. Relieve urinary retention. D. Provide ice packs. E. Turn and deep breathe. The answer is E. Avoid coughing. All of these are important nursing interventions for a post-op herniorrhaphy patient. The priority is to prevent increasing intra-abdominal pressure. Relieving urinary retention and avoiding coughing are the most important considerations to achieve this priority, but it is most important for the nurse to remember to avoid coughing, as it is most likely to increase intra-abdominal pressure. It is also important to remember because it is often promoted for other post-operative procedures, and this is one case where it is not. The community health nurse educates a group of young boys who are learning about hiking safety. Which of the following statements made by the nurse is not effective for preventing Lyme disease? A. You should be aware of where ticks infected with Lyme disease are located, particularly in the upper Midwest, New England, and the Mid-Atlantic region. B. You can take antibiotic medications before hiking to make sure you don't get Lyme disease. C. You should wear insect repellent on your skin and clothes if you are in an area endemic to Lyme disease. D. Try to cover as much of your skin as possible, long pants, long sleeves, long socks, and cover your neck and hands too. E. After you hike in a Lyme disease endemic area, carefully examine your skin for ticks. The answer is B. You can take antibiotic medications before hiking to make sure you don't get Lyme disease. Prophylactic antibiotics are not indicated for the prevention of Lyme disease. Antibiotics will be used after a tick bite when symptoms develop and an infection is suspected. The community health nurse should teach rules of prevention, including 1. Knowing where Lyme disease is prevalent, New England, Upper Midwest, Mid-Atlantic states. 2. Wearing long sleeves and long pants, covering as much skin as possible with clothing. 3. Using insect repellents such as sprays over the whole body, and 4. Checking for tick bites especially after exposure is anticipated, so you may receive care as quickly as possible if needed. Which of the following should be restricted in a patient with end-stage renal failure? A. Fluids. B. Protein. C. Potassium. D. All of these are correct. The answer is D. All of these are correct. A patient with end-stage renal failure should be kept on a low-protein, low-potassium diet. Fluid restriction is also an important part of management of patients with end-stage renal failure and patients on dialysis. A 75-year-old female with end-stage renal failure asks her nurse for advice about her diet. Knowing that this patient must adhere to a low-potassium diet, the nurse cautions her against which of the following foods? A. Eggplant. B. Cherries. C. Orange juice. D. Apples. The answer is C. Orange juice. Orange juice is very high in potassium. 1 12 ounces glass of orange juice contains 705 milligrams of potassium. This could easily increase blood potassium to dangerous levels. The other fruits and vegetables listed are all low potassium foods suitable for consumption by individuals needing to follow a low potassium diet. A nurse is looking over a basic metabolic panel for a 69-year-old male. She notices that his bun is 12 milligrams per deciliter. This value is dash. A. Normal. B. Depressed. C. Borderline elevated. D. Elevated. The answer is A. Normal. Bun, or blood urea nitrogen, is a measurement of the kidney's ability to excrete urea, which is a byproduct of protein metabolism. This patient's bun is within normal range. The reference range for bun is 7 to 20 milligrams per deciliter. You are the nurse taking care of an elderly patient with severe dementia and limited mobility who is at a high risk for developing a pressure ulcer. Which of the following options is the best first-line approach to preventing development of a pressure ulcer in this patient? A. Turning the patient multiple times per day. B. Applying topical antibiotic ointment to cover the patient's entire body surface. C. Administering broad-spectrum intravenous antibiotics. D. Request a dermatology consult. E. Administer a one-time dose of broad-spectrum intramuscular antibiotics. The answer is A. Turning the patient multiple times per day. In the preventive stage for pressure ulcer management, there is no need to perform any invasive procedures. Administer antibiotics in a patient who may be at high risk for needing broad-spectrum antibiotics in the future, hence fostering antibiotic resistance, or consult subspecialty services, as there is no dermatological condition to be treated at the moment. The best option to prevent a pressure ulcer in a patient who is at high risk for developing a pressure ulcer is to turn the patient regularly while they are in bed, if they are bedbound. By turning the patient, the high-pressure areas that would be at the highest risk for development of a pressure ulcer are able to have relief from pressure for a greater proportion of the day, night, and as such, can have blood flow restored while the patient is turned. By allowing for maximal blood flow to these regions, the risk of ischemia and subsequent infection and/or ulcer development is decreased. Without the actual development of an ulcer or infection, administering antibiotics, either topically, intramuscularly, or intravenously is inappropriate. The nurse taking care of a 15-year-old male wrestler at a primary care clinic who complains of a raised, red, ring-like rash with central clearing on his lower back that he states is very itchy. Which of the following is the most likely diagnosis? A. Tinea corporis. B. Tinea cruris. C. Tinea capitis. D. Tinea menuum. E. Tinea pedis. The answer is A. Tinea corporis. Tinea corporis is also known colloquially as ringworm. The described case is a classic case for tinea corporis, in which the patient is a young athlete, often a wrestler, due to the frequent skin-to-skin or skin-to-mat contact in damp, sweaty environments, who presents with an itchy, red, ring-like rash that exhibits central clearing. The word corporis qualifies that the fungal dermatophyte infection, tinea, is specifically located on the body/torso/back region. The other choices are incorrect, as tinea capitis is a fungal infection of the scalp, tinea pedis is a fungal infection of the feet, tinea cruris is a fungal infection of the groin, jock itch, and tinea menuum is a fungal infection of the hands. You are a nurse in an emergency department and a patient presents with a 5 cm by 6 cm abscess on the dorsal aspect of his left hand. The hand is very painful, but he has full range of motion, and no sensory deficits. He is febrile and has no systemic or localized symptoms aside from the abscess. Which of the following is the most appropriate next step in management? A. Prescribe oral antibiotics without draining the abscess. B. Inject steroid into the abscess. C. Amputate the affected hand at the wrist. D. Apply topical antibiotic to the abscess. E. Incision and drainage of the abscess. The answer is E. Incision and drainage of the abscess. An abscess, by definition, is a walled-off collection of pus and bacteria, that is typically impenetrable to topical or systemic antibiotics. The only way to truly resolve an abscess is to incise and drain it, such that the walled-off material can be expelled, and the pressure and pain can be relieved. Further, the material should be sent for culture so that the patient can be placed on appropriate antibiotics if the physician deems it necessary for post-drainage care. The other choices are incorrect. Surgical amputation of the affected hand would be a drastic measure for a localized abscess that is not otherwise causing limb ischemia or necrosis. Incision and drainage is a much more reasonable first step. Injecting a steroid into the abscess would be a potentially dangerous intervention, as steroids decrease the body's immune response to infection, and as such, could increase the bacterial load within the abscess, allowing it to expand and become more serious. As mentioned earlier, topical and oral antibiotics would likely be impenetrable to the abscess and would be inappropriate first steps when the option of incision and drainage exists. Which of the following causes microcytic hypochromic anemia? A. Chronic lead exposure. B. Iron deficiency. C. Thalassemia. D. All of these. The answer is D. All of these. All of these result in microcytic hypochromic anemia, which is a type of anemia characterized by small red blood cells called microcytes that contain lower concentrations of hemoglobin than healthy red blood cells. What is the most significant risk of hyperkalemia? Elevated serum potassium. A. Rhabdomyolysis. B. Sudden cardiac death. C. Respiratory depression. D. Weakness, tremors, and cramps. The answer is B. Sudden cardiac death. Mild hyperkalemia may be asymptomatic, but a significant rise if potassium levels above normal can cause fatal heart arrhythmia, resulting in sudden cardiac death. Weakness, tremors, and cramps are common symptoms of mild hypokalemia, depressed potassium levels, while respiratory depression and rhabdomyolysis can occur with severe cases of hypokalemia. Cranial nerves are important to assess to determine the neurological status of a patient in regards to possible deficits. All the following cranial nerves should be assessed for proper eye movement and function, including vision except dash. A. Cranial nerve 6. B. Cranial nerve 8. C. Cranial nerve 3. D. Cranial nerve 2. E. Cranial nerve 4. The answer is B. Cranial nerve 8. Cranial nerve 8 is the vestibulocochlear nerve responsible for hearing and balance. It does not control the eye. Cranial nerve 2 is the optic nerve, control vision and acuity. Cranial nerve 3 is the oculomotor nerve, which controls eye movement, pupil reflex, eyelid, and proprioception. Cranial nerve 4 is the trochlear nerve, which controls extraocular eye movement, as does cranial nerve 6, the abducens. What is the most common cranial mononeuropathy in diabetic patients? A. Cranial mononeuropathy 6. B. Bell's palsy. C. Auditory neuropathy. D. Third nerve palsy. The answer is D. Third nerve palsy. Third nerve palsy, cranial nerve 3, the oculomotor nerve, is the most common cranial mononeuropathy seen in diabetic patients. They will present with ptosis, dilated and fixed pupils, and an outward and slightly downward deviation of the eye. Bell's palsy involves unilateral facial paralysis as a result of damage to the facial nerve, cranial nerve 7. Cranial mononeuropathy 6 is caused by damage to the abducens nerve, cranial nerve 6. Signs of damage include inability to laterally rotate the eye and/or double vision. Auditory neuropathy may be a result of damage to the vestibulocochlear nerve, cranial nerve 8. The most pronounced symptom is loss of audition. What condition is described by the following? A defect of copper excretion, leading to copper overload and feedback inhibition of ceruloplasmin synthesis. A. Wilson's disease. B. Huntington disease. C. Ceruloplasminemia. D. Hereditary hemochromatosis. The answer is A. Wilson's disease. Wilson's disease is characterized by a defect of copper excretion, leading to copper overload and feedback inhibition of ceruloplasmin synthesis. This results in copper accumulation, primarily in the liver and the brain. Signs and symptoms include liver failure, cognitive deterioration, clumsiness, and changes in behavior. Symptoms often start in adolescence, but can start any time between 6 to 20 years old. Ceruloplasminemia is a rare condition of iron accumulation in the basal ganglia, retina, and liver. Hereditary hemochromatosis is also a disorder of iron accumulation, often caused by mutations in the HFE gene. Huntington disease is a genetic neurodegenerative disease unrelated to any mineral storage disorders. A 62-year-old male client is admitted to the hospital with acute pancreatitis. The client has a well-established history of alcohol abuse. The nurse caring for this client is aware he may exhibit withdrawal symptoms during the inpatient course. The nurse's plan of care for this client should include assessment for all the following symptoms of alcohol withdrawal except A. Hypersomnolence. B. Tremors. C. Visual hallucinations. D. Hypertension. E. Seizure within the first 24 hours. The answer is A. Hypersomnolence. The symptoms of alcohol withdrawal may include confusion, disorientation, and anxiety. Hypersomnolence or excessive sleep is not associated with this condition. Additional symptoms may include agitation, hypervigilance, tremor, rapid and irregular heartbeat, hypertension, seizure, and hallucinations, mostly visual. Approximately 80% of strokes are of what type? A. Hemorrhagic. B. Transient ischemic attack. C. Ischemic. D. None of these. The answer is C. Ischemic. Approximately 80% of strokes are ischemic, either caused by thrombus or emboli. Hemorrhagic strokes only account for approximately 15% of all strokes, but are significantly more lethal and account for 30% of all stroke deaths. They involve the rupturing of a weakened blood vessel in the brain and subsequent bleeding in the surrounding areas. Transient ischemic attacks are not considered true strokes, and are often referred to as mini strokes. Which artery is most commonly involved in ischemic stroke? A. The middle cerebral artery. B. The anterior cerebral artery. C. The posterior cerebral artery. D. The posterior inferior cerebellar arteries. The answer is A. The middle cerebral artery. The most common artery occluded in ischemic stroke is the middle cerebral artery, which supplies a large percentage of the frontal lobe and the lateral surface of the temporal and parietal lobes. Occlusion of this artery affects the motor and sensory areas of the face, throat, arm, hand and the areas for speech. Which of the following is the most common etiology of intracerebral hemorrhagic stroke? A. Medications. B. Arteriovenous malformation, AVM. C. Trauma. D. Hypertension. The answer is D. Hypertension. Hypertension is a leading etiology in intracerebral hemorrhagic stroke. Chronic hypertension can cause damage and stress to the blood vessel wall, leading to aneurysm or increased risk of spontaneous rupture. AVM, trauma, and medications such as blood thinners are all also responsible for a significant, though lesser, number of hemorrhagic strokes, or may be comorbidities that increase the risk of a rupture in the presence of prolonged hypertension. What is the most common cause of meningitis? A. Viral infection. B. Aseptic inflammation. C. Bacterial infection. D. Fungal infection. The answer is A. Viral infection. All of the answers given are possible causes of meningitis, but the most common, and least severe, etiology is viral. There is no vaccine for viral meningitis, but there are vaccines for 3 different organisms that cause bacterial meningitis. Neisseria meningitidis, meningococcus. Streptococcus pneumoniae, pneumococcus. Haemophilus influenzae type B, Hib. A client has a history of spinal injury and the nurse is evaluating the client with the onset of new symptoms. The symptoms include hypertension, a throbbing headache, a slow heart rate of 40 beats per minute, and piloerection. The nurse recognizes these symptoms are consistent with what disorder? A. Brown-Séquard syndrome. B. Spinal shock. C. Neurogenic shock. D. Malignant hypertension. E. Autonomic dysreflexia. The answer is E. Autonomic dysreflexia. These symptoms are evidence of autonomic dysreflexia, which is a sequela of spinal shock. It is a medical emergency and requires immediate intervention as it may lead to stroke, cardiac arrest, coma or death if untreated. A 23-year-old male college student presents to the emergency room after experiencing a high fever, nausea, vomiting, and knuckle rigidity. The nurse recognizes that this combination of symptoms are indicative of bacterial meningitis. The nurse is aware cranial nerve dysfunction is related to the condition. Which of the following cranial nerves, CN, is correctly matched to its dysfunction? A. Irritation of CN6 may cause hearing disturbances such as tinnitus. B. Irritation of CN5 may lead to loss of the corneal reflex. C. Irritation of CN3 may cause papilledema as seen with increased intracranial pressure. D. Irritation of CN2 may cause ptosis, a drooping of the ipsilateral eyelid. E. Irritation of CN8 may cause deficits in facial movements. The answer is B. Irritation of CN5 may lead to loss of the corneal reflex. The trigeminal nerve, CN5, is responsible for both sensory and motor functions of the face, including the corneal reflex, which is also mediated by the facial nerve, CN7. CN2, optic nerve, affects vision, including causing papilledema, swelling of the optic disc. CN3, oculomotor dysfunction may cause ptosis. Cranial nerve 8, vestibulocochlear, is responsible for hearing, and cranial nerve 6, abducens, is responsible for horizontal eye movements. A 27-year-old female presents complaining of an inability to smile normally or close her left eye. She states that she woke up and noticed that the left side of her face was not responding when she tried to blink, smile, or speak. She also feels a pain in her left ear. She has never experienced this before. The nurse does a physical exam, which is notable for left-sided upper eyelid retraction, general left-sided facial muscle weakness, and left-sided brow droop. There are no cognitive or sensory defects noted. What is the most likely cause? A. Otitis interna. B. Myasthenia gravis. C. Bell's palsy. D. Transient ischemic attack. The answer is C. Bell's palsy. The symptoms and physical exam of this patient are consistent with the diagnosis of Bell's palsy, a rapid onset cranial nerve disorder that results in unilateral facial paralysis or weakness. Symptoms usually come on within 24-72 hours and may include facial tingling, ear pain, taste disturbance, headache, issues with balance, cognitive changes, and clumsiness. A young woman presents to a clinic complaining of unilateral headaches that she describes as throbbing, like a hammer was hitting my head. She experiences these headaches 5 to 10 times per month, and an episode can last up to 24 hours. During the headache she is sensitive to light, sound, and smell. On a few occasions the pain has been severe enough to induce vomiting. She feels better with coffee, and by lying down alone in a dark room. Her headache is most likely which of the following types? A. Sinus. B. Tension. C. Migraine. D. Caffeine withdrawal. The answer is C. Migraine. The symptoms this individual describes are most likely due to migraine headache, migraine without aura, also known as common migraine. Migraines are diagnosed by the following criteria: more than 5 episodes, lifetime. Headache lasts 4 to 72 hours. During headache at least one of the following: nausea, vomiting, photophobia or phonophobia. Headache has at least 2 of the following characteristics: unilateral, moderate or severe pain intensity, pulsating. Aggravation by normal physical activity, may cause avoidance of normal activities of life. Not attributed to another disorder. A 37-year-old man comes into the clinic for chronic headaches. He describes his headaches as in his forehead and temples bilaterally, occasionally wrapping around his head toward his neck. Pain is rated as a 4 out of 10. He has these headaches around 3 times per week. No photophobia with his headaches, no nausea or vomiting. Headache feels better when he presses on his scalp. When asked to describe the sensation of the headache, he replies that it's like a band around his head. These headaches are not preventing him from normal activity. These are most likely what type of headache? A. Cluster headaches. B. Ocular migraine. C. Classic migraine. D. Tension headaches. The answer is D. Tension headaches. The symptoms described by this individual make tension headaches the most likely diagnosis. Tension headaches are defined by the following criteria: minimum of 10 episodes occurring on less than 15 days per month for at least 3 months. Headaches last from 30 minutes to 7 days. Headache has at least 2 of the following qualities: mild or moderate intensity, bilateral, pressing or tightening, non-pulsing, quality, not aggravated by routine activities of daily living. Both of the following: no nausea or vomiting. Either photophobia or phonophobia, but not both. A 21-year-old male presents to clinic for extremely painful headaches. Pain is felt above the left eye and described as a 9 out of 10. Headaches are short, most episodes last for 30-45 minutes, and always on the left side. He notices that during an episode, his left eye will become red and watery, and his nose will run on the left side. He has up to 3 episodes per day. During a headache he will become agitated and restless, and will pace, groan, and hit the wall or floor with his fist. He is very concerned that he may have a brain tumor, meningitis, or some other serious condition. His headaches are most likely which of the following types? A. Tension headache. B. Migraine without aura. C. Migraine with aura. D. Cluster headache. The answer is D. Cluster headache. The presentation of this patient's headaches would make cluster headache the most likely diagnosis. Cluster headaches are defined by the following criteria: at least 5 attacks, severe unilateral orbital, supraorbital or temporal pain lasting 15 to 180 minutes. Headache is accompanied by at least one of the following: ipsilateral conjunctival injection and or lacrimation, ipsilateral nasal congestion and or rhinorrhea, ipsilateral eyelid swelling, ipsilateral facial sweating, ipsilateral miosis or ptosis, restlessness or agitation. Attack frequency ranges from every other day to 8 per day. Not attributed to another disorder. Which of the following is not a common trigger for migraine headaches? A. Caffeine. B. Medication. C. Food allergies. D. Lack of sleep. The answer is A. Caffeine. While caffeine may be a migraine trigger for certain individuals, in the majority of people who experience migraine headaches, Caffeine provides significant relief of pain. This may be due to its antagonizing adenosine receptors, which has the effect of cerebral vasoconstriction. Caffeine withdrawal, however, is a common cause of headaches and may trigger migraine in susceptible individuals. Other common migraine triggers include food allergies, medications, bright lights, stress, lack of sleep, hormone fluctuations, strong odors, alcohol, and certain types of exercise. Which of the following seizure types is characterized by a brief loss in muscle control, often resulting in a fall or collapse, in the absence of spasm or rigidity? A. Myoclonic seizure. B. Tonic-clonic seizure. C. Absence seizure. D. Atonic seizure. The answer is D. Atonic seizure. Atonic seizures are characterized by brief, 2 to 15 second, loss or lapses in muscle control, resulting in sudden relaxation of the neck, legs, or whole body. This seizure type frequently causes injury due to falls or head trauma. There may be spasm or twitching at some point during an atonic seizure, but they generally present without any form of rigidity or clonus, unlike tonic-clonic and myoclonic seizures. Atonic seizures differ from absence seizures in that an individual experiencing absence seizures will generally only experience a loss of consciousness, without an accompanying loss of muscle control. Which of the following symptoms describes a typical aura experienced during a complex partial seizure? A. Visual disturbances such as sparks, color fluctuations, or blurry vision. B. Olfactory disturbances, unusual smells, smelling things that are not present. C. A sense of déjà vu or feeling that everything is strangely unfamiliar, jamais vu. D. Odd taste in the mouth. E. All of these are correct. The answer is E. All of these are correct. The aura experienced before a seizure, while frequently thought of as a primarily visual experience, can include disturbances in taste or smell, bodily sensations such as stomachache or tingling, anxiety, or a sense that everything is oddly familiar, déjà vu, or unfamiliar, jamais vu. Which of the following describes a generalized seizure? A. A seizure that involves a specific area limited to one hemisphere of the brain in which there is no loss of consciousness. B. 30 minutes or more of uninterrupted seizure activity. C. A seizure that involves a specific area limited to one hemisphere of the brain in which there is loss or impairment of consciousness. D. A seizure that involves both sides of the brain simultaneously from onset and results in loss of consciousness. The answer is D. A seizure that involves both sides of the brain simultaneously from onset and results in loss of consciousness. A generalized seizure is one which involves both sides of the brain simultaneously from onset and results in loss of consciousness. This is contrasted with complex and simple partial seizures, in which only one area of the brain is involved and the individual may or may not lose consciousness, in complex and simple partial seizures, respectively. Seizure activity that lasts for 30 or more minutes is a rare and serious condition known as status epilepticus. Any seizure that lasts for over 5 minutes is considered a medical emergency and requires emergency assistance. Which of the following is not a type of seizure? A. Myoclonic. B. Absence. C. Simple partial. D. All of these are seizure types. The answer is D. All of these are seizure types. Currently there are over 40 distinct types of seizures recognized by the medical community. Some of the most common seizure types are generalized tonic-clonic, absence, myoclonic, clonic, tonic, febrile, and atonic. Some other less common types include refractory seizures, gelastic seizures, and acrostic seizures. A 7-year-old girl is having issues in school due to lack of attention. Her teacher states that she will space out frequently for a period of 10 to 20 seconds. During these times she will stare straight ahead and will not respond to questions, even if she is called on directly. She does not have any tics or facial movements during these episodes, other than a slight fluttering of the eyelids. Her teacher states she does this several times during the school day, and that it is impacting her performance in school because she is unable to remember what the teacher was talking about during the spell. This child is most likely experiencing which of the following types of seizures? A. Atonic. B. Absence. C. Myoclonic. D. Clonic. The answer is B. Absence. Absence seizures are typified by a brief, 2 to 30-second loss of consciousness in the absence of other symptoms. Individuals with this condition generally will not experience muscle rigidity, as in a tonic seizure, or jerking, as in clonic or myoclonic seizures, nor do they experience a loss of muscle tone, as seen in atonic seizures. Absence seizures present frequently in young children as staring spells and may cause issues with learning or appear as inattentive behavior in school until correctly diagnosed by a medical professional. A 7-year-old girl is having issues in school due to lack of attention. Her teacher states that she will space out frequently for a period of 10 to 20 seconds. During these times she will stare straight ahead and will not respond to questions, even if she is called on directly. She does not have any tics or facial movements during these episodes, other than a slight fluttering of the eyelids. Her teacher states she does this several times during the school day, and that it is impacting her performance in school because she is unable to remember what the teacher was talking about during the spell. Which of the following diagnostic tool would help this child's provider identify her spells as absence seizures? A. CNS ultrasound. B. Magnetic resonance imaging, MRI. C. Computed tomography, CT. D. Electroencephalography, EEG. The answer is D. Electroencephalography, EEG. While CT and MRI may aid in discovering structural abnormalities associated with certain seizure disorders, the correct tool for diagnosis of seizures is electroencephalography, EEG. An EEG can show abnormal surges in brain activity responsible for temporary loss of consciousness in absence seizures. A 3-year-old patient presents for a seizure that occurred at home. To her father's knowledge, she has never had a seizure in the past. She was not ill at the time of the seizure, and she is not on any type of medication. There was no head trauma before the incident. Her father states that her older brother was diagnosed with epilepsy at age 7, and that his grandmother was also epileptic. Is it safe to assume that this child is also epileptic? A. No. Epilepsy is not hereditary, and must present with a history of at least 2 seizure episodes before diagnosis. B. Yes, epilepsy is defined as seizures in the absence of fever, head trauma, or medication. C. No, a diagnosis of epilepsy requires 2 or more seizures without a clear provocation. D. Yes, she has a positive family history for epilepsy, and has had a seizure with no clear provocation. The answer is C. No, a diagnosis of epilepsy requires 2 or more seizures without a clear provocation. While epilepsy may certainly be hereditary, the diagnosis of epilepsy requires the occurrence of at least 2 seizures during 2 separate incidents, regardless of positive family history. These must occur in the absence of provocative factors such as fever, head trauma, or medication. Which of the following is not a form of generalized seizure? A. Tonic-clonic. B. Complex partial. C. Myoclonic. D. Atonic. The answer is B. Complex partial. Generalized seizures are defined as seizures in which both hemispheres of the brain are affected by seizure activity from the onset. There are 4 main types of generalized seizures: tonic-clonic, myoclonic, atonic, and absence. All of these result in loss of consciousness and may or may not cause spasm or clonus. Complex partial seizures, while also resulting in a loss of consciousness, are restricted to one hemisphere of the brain. What is the most common type of seizure in adults? A. Myoclonic. B. Nonpoleptic. C. Simple partial. D. Tonic-clonic. The answer is D. Tonic-clonic. The most common type of seizure in adults is the tonic-clonic seizure, also known as grand mal. These seizures have 2 stages: a tonic stage, characterized by muscle stiffening and rigidity, followed by a clonic phase, characterized by jerking and twitching of the muscles and the face. Some individuals may have a tendency to have more tonic symptoms or more clonic symptoms, or may go in a tonic-clonic-tonic pattern of alternating rigidity and jerking motions. Individuals in a tonic-clonic seizure experience loss of consciousness and may experience headache, lethargy, confusion, or may want to go to sleep on recovery of consciousness. Which of the following is a term for total absence of sense of smell? A. Hyposmia. B. Dysosmia. C. Anosmia. D. Hyposmia. The answer is C. Anosmia. A total loss or absence of sense of smell is called anosmia. It may be caused by a wide variety of medical conditions, including trauma to the head, stroke, nasal blockage, various dementias, viral infection, toxic exposure, autoimmune disease, or zinc deficiency. Hyposmia is a state in which sense of smell is reduced but not absent, while hyposmia is an increased sensitivity to smell. Dysosmia is an alteration in the perception of smell which may include olfactory hallucinations or distortions. Which of the following is a condition of reduced sensitivity to taste? A. Ageusia. B. Parageusia. C. Dysgeusia. D. Hypogeusia. The answer is D. Hypogeusia. Hypogeusia is a condition of reduced sensitivity to taste. This may be due to various causes, including brain injury, viral infection, zinc deficiency, certain medications such as chemotherapeutic agents or antibiotics. Dysgeusia and parageusia both describe alterations in the perception of taste. These conditions can have similar etiologies to hypogeusia. Ageusia is the total absence of taste perception.